This mystery diagnosis, more commonly found in women than men, is characterized by a pervasive pattern of major attention seeking. Typically, these patients do not see how their behaviors impact the people around them. These patients worry so much about their appearance and impressing others that they end up spending more money, energy, and time in the end. A person with this diagnosis has trouble forming meaningful relationships and lacks attention to detail. Sometimes they may even be described as theatrical.
Help me! Help me!
Are you okay?
No! I literally just fell in the freaking trash can.
Okay. Is anything bleeding or
I think I
hurt?
broke my leg.
Oh, okay.
Yeah.
Okay. I'll get you checked out. Okay.
Okay.
This disorder is among the least understood mental health conditions. Tests and studies have been performed to identify several factors that lead to the development of this particular disorder. Those factors include genetics, childhood trauma, and parenting styles. When mental health professionals suspect that a patient may have this disorder, they often ask broad general questions that will not generate a defensive response or hostile environment. They typically ask the patient and their families about past history, relationships, previous work history, reality testing, and impulse control. Using the Diagnostic and Statistical Manual of Mental Health Disorders, diagnosis of this condition requires the patient to meet 5 of the following persistent behaviors: uncomfortable when not the center of attention, seductive or provocative behavior, shifting and shallow emotions, uses appearance to draw attention, impressionistic and vague speech, dramatic or exaggerated emotions, suggestible, and considers relationships more intimate than they are.
What's going on?
So, we got a call from her daycare, and apparently she was having trouble breathing. We brought her in, gave her a checkup, and she's doing well right now, but we just want to give you a call.
Well, do you know she has asthma?
She did tell us that. That would kind of make sense.
Susie, where the frick is your inhaler? You lost it. Well, guess what? I have a date tonight with Jen. And you ruined it for me. Can you watch her? How long is she here for?
We're probably going to keep her overnight.
Okay, so Susie, when you're ready tomorrow and you get your act right, they'll call me and I'll come get you. Otherwise, I gotta go get ready for my date. Like, why would you do this on the day that you know I have my date? I've gotta go. Get it together.
A person with this mystery diagnosis may seem like they are attention-seeking, seductive, manipulative, or exhibitionistic. These patients may be well-liked, admired by many, popular, sociable, and attractive. Their behavior may be dramatic, colorful, or even extroverted. You may see this person spending hundreds of dollars on clothes and appearance. These patients typically fish for compliments, seem self-absorbed, or may make up false stories to try to get attention.
Caitlin. Will you marry me?
Yes. Guys, wait, hold on. I'm literally pregnant. Hello.
Hey, Banana.
What, Mom? You know I'm going through a lot.
What's going on?
You won't believe it.
What?
So today, I was just at the park and I seen one of my friends getting engaged.
Really? That's cool.
No, actually it's not. So you know what I did?
What?
I went up there and told him I was pregnant.
You're pregnant?
No, but this is my day. Every day. And like, why would they try and make it about them? Literally. Like, they can always get remarried, right?
But honey.
No. No. They're literally selfish and rude.
But you're not pregnant.
That's not the point. That's not the point. And you're really making me upset, so I'm gonna go.
Okay.
I'm gonna go. Bye.
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 When assessing a patient with this mystery disorder, it is very important to look at the person from a holistic point of view. Some questions you might ask yourself while you evaluate the patient are: how do they dress or appear? How do they view themselves and others around them? You notice a rapid mood shift from laughing 1 minute to crying the next. How does this person perceive the people around them?
Hey, girl.
Hey.
What are you doing?
Oh, I'm just studying. I failed my test this morning, so I really need to walk in.
No way.
Yeah, I know. I'm pretty bummed about it.
Are you having a bad day?
I am. I cried a lot about it earlier, but I think I've realized that it's okay.
No, me too. I'm having a bad day.
Oh, you are?
You know what happened?
What happened?
I was walking outside and I was carrying some groceries. And I literally had my hands full and I literally dropped it. One of them. So I had to go inside, put the rest down, and go back outside and pick it up.
Oh my gosh, I hate it when that happens. Well, if it makes you feel any better, this morning I left my keys in my car.
It doesn't, because you know why?
Why?
My car got stolen.
Oh my gosh, really?
Yeah.
Wow. Well, if it makes you feel any better, I had to go to the ER yesterday because I had an allergic reaction to peanuts.
You know what else happened?
What else happened?
My grandma died.
Oh my gosh. Are you okay?
No, I'm having the worst day ever.
Oh, I'm so sorry. Is
No.
there anything I can do to make it
No,
better?
So you're making it worse.
you're actually making it worse.
Well, I'm sorry. I can keep studying if you don't want to talk about anything.
Did you have anything else go bad?
Actually, yeah, I made my breakfast this morning and my dog got and ate everything in my bowl.
Oh yeah?
Yeah.
Well, guess what?
Did something bad
I can
happen
afford
to you?
breakfast.
Oh, okay.
When caring for a person with this disorder, it is very important for the nurse to establish professional boundaries, use therapeutic communication, maintain patient safety, give the patient feedback about their social interactions, teach social skills and role play those skills in a safe, non-threatening environment, and lastly, refer patients to psychotherapy, local support groups, and other community resources.
Hey, I see your collate's going off. Anything I can help you with?
Actually, yeah. Are you single?
That is an inappropriate boundary.
While this disorder does not have a cure, most people live long, successful lives with the help of ongoing treatments. Some positive outcomes for people with this disorder include improved coping and social skills, boost self-awareness and self-esteem, enhanced emotional regulation, ability to function in social situations, and improved quality of life. Though most people have positive outcomes, some people live with severe forms of this disorder and can be at high risk for developing other issues. Some negative outcomes may include difficulty maintaining healthy jobs and relationships, anxiety and panic attacks, depression and suicidal thoughts, cannabis and alcohol use disorder, and somatic system disorder.
Hey, girls.
Hey.
What are you guys doing?
Oh, I'm just studying for my next test.
I'm just working on lab stuff.
So, what did you guys get on the last test?
I got a 98.
How about you?
I got a 90.
Well, guess what?
What did you get?
100.
Oh, wow. Good
It's a
job.
really hard exam.
Yeah, and I really don't know how anybody got less than 100, really. Like, that was literally so easy. And honestly, I think the people who didn't just suck.
I mean, it was a hard test, though.
Yeah.
Oh, yeah, no, for sure, but, like, obviously 100 is the best.
Well, I'm glad that you got a 100. That's great.
What did you guys get on the test before that?
That one I didn't do so hot. I got like an 82.
Yeah, I was around the 80s too.
Yeah.
You know what I got?
What did you get?
Take a guess.
A 90.
Really? So you think I suck?
No, a 90 is good.
A 90 is good.
Well, guess what I got?
What?
A 100.
Oh.
Wow.
Have you got
That's
100
awesome.
on every exam we've had?
Yeah.
Oh.
Well, that's
Hey,
good.
you
You
know,
must
I don't
study a
even
lot.
know.
You don't study.
I don't even have to try.
Oh,
I know.
wow.
Like, I'm literally the best.
Wow, I wish I
The
could
best
be
till
like
the
that.
rest.
Okay.
You actually think she's got 100 on every exam?
I don't know. I find that hard to believe.
I know. I think she kind of fabricated the story a little bit.
Yeah, especially if she's not studying. Because I know I study my butt off and I'm still not getting 100.
I know. And those exams, even the professors say that they're hard.
Yeah.
Hmm.
Oh, maybe she just wants the attention.
Yeah.
This diagnosis can be very difficult for both the patient and the patient's family. Because of this, it is vital that the nurse teaches about healthy ways to cope with this diagnosis. Some patient education includes develop healthy coping skills, respect others' boundaries, regularly participate in therapy and support groups, take medications as prescribed, develop a positive self-image, identify triggers, and practice social skills that are taught in therapy. Some family education includes create clear boundaries and encourage the patient to be independent when possible, learn about the disorder and ways to help the patient cope using healthy coping strategies, validate the patient's feelings and respond calmly during outbursts, and attend support groups that are structured around coping with a loved one who has this disorder.
I'm sorry, she just passed away.
Grandma, really? On my birthday?
In most cases, individuals with this disorder do not see a problem with their behavior. This makes treatment rather difficult. However, they may seek help if depression or another problem caused by their thinking or behaving causes them distress. Types of psychotherapy that could benefit people with this disorder include group therapy, psychodynamic psychotherapy, supportive psychotherapy, and cognitive behavioral therapy. While there is currently no medication for this specific disorder, there is medication for depression and anxiety, which some deal with as well. Treating depression and anxiety may make it easier to treat this disorder. As we mentioned before, though there is no cure for this disorder, many individuals dealing with the condition often live productive lives. Patients who participate in talk therapy tend to have better outcomes as they gain insights into their illness and function better in social situations. However, people with the severe form of this disorder experience frequent issues at work, in friendships, and in romantic relationships. Success in the treatment plan for this disorder might include a reduction in attention seeking, improved emotional regulation, report of more stable relationships, an increase in self-awareness, and improved functioning. Now let's look at some of the behaviors associated with this disorder through some TV and pop culture viral moments.
For giving me a chance to win a VMA award.
Yo, Taylor, I'm really happy for you. I'm gonna let you finish. But Beyonce had one of the best videos of all time. One of the best videos of all time.
Save this Kleenex you used, and she said she's gonna do some kind of African voodoo with it to make you like her.
What?
This was it. Regina said she would talk to Aaron for me, and now she was.
I know she's kind of socially retarded and weird, but she's my friend, so just promise me you won't make fun of her.
Of course I'm not gonna make fun of her.
How could Janice hate Regina? She was such a good...
Morning, everyone. Don't freak out. I forbid anybody to freak out. Clearly, I have had a very serious accident, but I will recover, God willing. I just want to be treated normally today. Normal would actually be good, considering the trauma that I've been
You
through.
missed 2 big conference calls today, one with corporate.
Oh, did you explain why?
No, I didn't mention that you cooked your foot.
Burn my foot, Pam.
A clinical and forensic psychologist who was hired by Johnny Depp's legal team to evaluate Amber Heard has testified that the actress showed signs of not post-traumatic stress disorder. On day 9 of Depp's defamation trial against Heard, Dr. Shannon Curry told the court that she was asked to provide a psychological evaluation of Heard back in October of 2021, but was never asked to do so for Depp. She had met with Heard on 2 separate occasions, each time for about 12 hours. The Mayo Clinic defines as dramatic, overly emotional, or unpredictable thinking or behavior.
So pick me. Choose me. Love me.
Now it's time to take your guesses. The disorder we've been talking about is histrionic personality disorder.
Open your boxes. 1, 2, 3.
You like how I did that?
Wait. Ding ding.
Hello, I see your call lights going off. Everything okay in here?
Hey, Doc.
You move because this freaking thing fucked.
I don't think I'll grab her hinge. Oh shoot, it's my girl. Girl. I didn't answer it.
You're not actually
Oh, I'm sorry. Hey girl.
Oh, hey.
What are you doing?
Oh, nothing. Just setting for the next test.
Ew!
What is it?
Redo.
Susie? Are you serious?
Oh,
What's going on?
She came in here, the daycare called. She's having trouble breathing, so we decided to give you a call, give her a checkup. She's doing all right. What's funny about that?
Susie? What's going on?
What are you doing?
Really? What's going on?
We got a call from the daycare. Apparently she was having trouble breathing, so we did decide to
Trouble
bring her.
breathing?
Yes, that's the report we got.
Why?
I'm not really sure. I think maybe playing a little too hard at recess. So we decided to bring her in here and give her.
Is she sedated?
No, she's with us.
You're something, yeah.
Why would you sedate her?
What's going on?
So we got a call from her daycare saying that she just could not breathe. So we decided to bring her in here and give her.
Are you sure?
We got that call. Yeah, like, what do you mean?
What's going on?
And I got a call from the daycare saying that she was just having trouble breathing, so we decided to bring her in here, give her a
Well,
quick
she
checkup.
has asthma.
That is probably why. Okay, let's keep it short and sweet because I can't get through this.
She's taking care of her.
I haven't had peds yet. Like, I don't know.